Monitoring some of the other top stories in the Situation Room right now. Lisa, what else is going on?
Hi again, Wolf. Well, the Food and Drug Administration has approved an unprecedented treatment for prostate cancer. It's called PROVENGE.
This is the culmination of decades of research into harnessing the immune system to fight tumors.
PROVENGE trains the body's own immune system to fight.
A novel way to attack prostate cancer.
It involves taking a patient's own white blood cells and using a drug that trains them to more actively attack cancer cells.
The power to fight advanced prostate cancer is already within you. With PROVENGE, you can turn on that power, arming your own immune cells to find and attack prostate cancer cells. The following video presents a conversation between a doctor, his patient, and his patient's care partner about a different treatment option for advanced prostate cancer, PROVENGE.
Hi. Gary and Beth. It's good to see the two of you again. Have a seat.
Good to see you.
Yeah. Everything been good?
Good.
Yep.
Yes.
All right. Gary, we've talked about your rising PSA levels and how your prostate cancer has spread. Now it's time to talk about the next step in your treatment.
Last time we were here, you mentioned a therapy called PROVENGE, Dr. Vetri. There was something different about it, wasn't there?
Oh, definitely. PROVENGE is the first personalized therapy for advanced prostate cancer. I think the best way to describe it is that PROVENGE trains your body's own immune cells to find and attack prostate cancer cells.
Is it a chemotherapy? We've read a lot about chemo treatments.
No, PROVENGE is not a chemotherapy, and it's different from hormone therapy, too. PROVENGE can be used before a patient moves on to chemotherapy. PROVENGE is what we call an immunotherapy. Gary's dose of PROVENGE would be made from his own immune cells. Here, let me show you. Every day, immune cells in your body help protect you from infection and disease. Now, prostate cancer is not an infection. The immune system's not able to recognize and fight cancer in the same way. And that's where PROVENGE comes in. PROVENGE is made by mixing some of your immune cells with a substance that activates them, or basically turns them on. These activated immune cells then train other immune cells in your body how to target and fight your prostate cancer. That's what makes PROVENGE different. Each dose would be made specifically for you from something that's already in your body.
How well does it work, Dr. Vetri?
Well, PROVENGE may help Gary live longer. In a clinical study, it actually reduced the risk of death in men with advanced prostate cancer by about 22%, compared with a control group of men who were not treated with PROVENGE. Oh, and another statistic you should know, more men who received treatment with PROVENGE were alive at 3 years than those who did not receive PROVENGE.
So this can help me live longer.
That's exactly what we're looking for.
Will my PSA levels go down?
Gary, immunotherapy works differently than chemotherapy, so you may not see a drop in your PSA levels. Now, that doesn't mean PROVENGE is not working. What we're doing is getting your immune system into the fight. With PROVENGE, we're helping you attack the prostate cancer with your own defense system. And remember, even if there's no change in your PSA, PROVENGE may help you live longer. Now, I also wanted to tell you about some of the possible side effects.
Yes, I wanted to ask you about that.
Well, the side effects are generally mild to moderate and usually don't last more than a day or two. The most common side effects are chills, fatigue, fever, back pain, nausea, joint ache, and headache. Think of it as having flu-like symptoms for a day or two. And we can give you some Tylenol and Benadryl before you get your dose of PROVENGE, and this can help minimize some of these side effects. Now, you should know that in some clinical studies, some patients experienced more serious side effects. They were mostly infusion reactions, and they generally occurred a day or so after the infusion of PROVENGE.
How does that sound?
I can handle that. How do I get started?
Well, it's a straightforward process. Therapy with PROVENGE can be completed in about a month. It's done in 3 treatment cycles. Each cycle is made up of 2 appointments. One, to collect your cells. Another, to infuse the PROVENGE dose into your body. Each cycle is usually spaced about 2 weeks apart.
That's great. So you're saying I could be done with this treatment in as little as a month?
Yeah. And actually, your time commitment's really only about 6 days of that month.
Well, do you think I'm a good candidate for this therapy?
Yes. This might be just the right time for you to start therapy with PROVENGE. You've been on hormone therapy for a while now, but your PSA levels are going up. And the scan you had tells us your prostate cancer has spread. But you haven't needed narcotics for any pain from your cancer yet, even though it's progressed. So, yeah, you're a good candidate for PROVENGE.
I know chemo is an option, too. Why not chemo first, doctor?
Well, we can always treat with chemotherapy down the road. PROVENGE does not change that. But we want to get your immune system fighting this disease as early as possible for as long as possible.
So can you tell us a little bit more about what happens during the PROVENGE treatment process?
Yeah, sure. First, we'll collect some of Gary's immune cells at the local blood collection center. Then we'll send those cells to a manufacturing facility, and they'll create Gary's own dose of PROVENGE. Now, once his dose is ready, it'll be shipped back to us so that it can be infused into his body. That's basically it.
It does sound pretty straightforward. But what about the cost? Is this something I can afford?
Well, both Medicare and private plans cover PROVENGE. My staff says that about 75% of patients on PROVENGE are expected to have minimal to no out-of-pocket cost. And for patients who do need help, financial assistance is available. Now, here's some more information on financial assistance programs. Beth and Gary, if you have any other questions about PROVENGE, you can always give me a call.
Let's get started, Dr. Vetri. Can we begin treatment this month? Beth and I have some travel plans coming up.
Oh, that's great.
Actually, we're planning on visiting our new grandson.
Oh, congratulations.
Thank you.
Well, then I'll get things going right away. Let's get your immune system fighting this disease.
PROVENGE Sapulus LT is approved by the FDA as an autologous cellular immunotherapy for the treatment of asymptomatic or minimally symptomatic metastatic castrate-resistant hormone-refractory prostate cancer. PROVENGE is made from your own immune cells. Your cells will be collected at a cell collection center approximately 3 days before each scheduled infusion of PROVENGE. There can be risks associated with the cell collection process, which you should discuss with your doctor before deciding to begin treatment with PROVENGE. PROVENGE can cause serious reactions. In controlled clinical trials for the treatment of prostate cancer, serious reactions reported in patients in the PROVENGE group include reactions resulting from the infusion of the drug, which occurred within 1 day of infusion, and strokes. Severe infusion reactions included chills, fever, fatigue, weakness, breathing problems, shortness of breath, decreased oxygen level and wheezing, dizziness, headache, high blood pressure, muscle ache, nausea, and vomiting. Tell your doctor right away if you have breathing problems, chest pains, racing heart or irregular heartbeats, dizziness, nausea, or vomiting after getting PROVENGE, because any of these may be signs of heart or lung problems. The most common side effects reported with PROVENGE are chills, fatigue, fever, back pain, nausea, joint ache, and headache. These are not all the possible side effects of PROVENGE treatment. For more information, talk with your doctor. Tell your doctor about all your medical problems, including heart problems, lung problems, or a history of stroke. Tell your doctor right away if you get a fever over 100 degrees Fahrenheit or redness at the cell collection or infusion sites, because any of these may be signs of infection. Tell your doctor about all the medicines you take, including prescription and non-prescription drugs, vitamins, and dietary supplements. Tell your doctor about any side effect that concerns you or does not go away. For more information on PROVENGE, please see the full prescribing information